Hi, my name's Dr. Andy Mellis and I'm a GP here in Toowoomba. We're talking today about assessing fitness to drive in the elderly. This has, of course, been a really political subject recently, with lots of reports about whether or not elderly people should be driving, but many of them are, of course, perfectly capable. I always like to start that discussion with my patients asking them a few questions. For example, I'll always ask them if they've caused any accidents in the past 12 months. I'll ask them if they've been stopped by anybody for dangerous driving. And I'll ask them if any of their relatives or friends or family have told them that they've got concerns about their safety to drive. Having done that, I'll then move on to get them to sign the disclosure on their medical certificate, reminding them that it is their obligation to tell me if they've got any concerns themselves or bad experiences about their driving at that point. When it goes on to actually assessing their fitness to drive, it's obviously a massive issue, and one that I think you really can't do unless you have a copy of the fitness to drive guidelines. And if you don't have one, you can get one sent out for free from the Department of Transport. They have an address and a phone number on the back of the book, so I'm sure there'll be one in one of your practices and you can request one of those copies. It really is then a case of just working through their medical conditions, referring to the sections in the book, and taking them bit by bit through the process to see if there's any criteria that they have to meet, or any restrictions that are imposed on them from their medical conditions. And many of them may have conditions that need to be referred for specialist approval, particularly, of course, diabetes is one of the most common, if their level of treatment requires that. So I'd really recommend you to get a copy of that book, as it will help you no end when deciding really whether or not you're comfortable to provide them with that medical certificate. If you are in doubt and you're really not sure about whether or not they will pass the criteria, you're definitely safer to err on the side of caution. You do have the option to refer them to a qualified occupational therapist, and they can do a full driving capability assessment on that patient and then send you back a report that will give you some confirmation about whether or not you're safe to certify that driver to continue driving. Hopefully that'll help you out a bit.